How can interoperability improve care coordination across inpatient, outpatient, and specialty care, especially in large and rural healthcare systems?
Oh, absolutely. So, especially for the rural healthcare systems, the biggest thing is like they typically, even this is an issue with the smaller practices as well, they can't afford all the big bells and whistles. They can't afford the 800-pound gorilla. They can't afford the rocket ship. So they wind up going with more cost-effective solutions that's within their budget. And so, a firm like ours can come in and say, okay, hey, you don't have the most top-end EHR that's super, that costs millions of dollars. You don't have the most expensive integration engine. You don't have the most, you don't have the most superstar, IT integration staff, that has all the knowledge. So, what can happen here is that we can take the principles of integration and still, assess, their, full, all their systems, all like a rural hospital systems, and then we can connect the data and make it more efficient between the different systems where there can be, where we can see improvements. So especially, smaller hospitals like that or rural hospitals, they probably, more likely have a huge data fragmentation issue. And so what that does is that limits their access to information, which can make it very challenging for treating the patient. So improving just in a rural hospital coming in and providing some streamlined solutions that can significantly improve their interoperability. That could be a huge benefit for error reduction, all the different things that interoperability addresses. Better patient outcomes, increased revenue, being more compliant, security, and all those things.